Good morning. I see you've brought David in today. What seems to be the problem?
Bonjour, docteur. Depuis quelques jours, David se gratte souvent autour de l'anus et c'est encore pire la nuit.
Oui, et il se réveille souvent en pleurs. C'est comme si ça le dérangeait beaucoup. Il essaie de se soulager, mais ça ne marche pas.
It sounds like it could be a pinworm infection. Have you noticed any other symptoms like stomach aches or changes in his bathroom habits?
Il ne se plaint pas trop de douleurs au ventre, mais il a eu quelques petites diarrhées. Sinon, il mange normalement.
Oui, il mange bien, mais il devient vraiment grincheux à cause des démangeaisons.
It's common for pinworms to cause itching around the anus, especially at night. The worms lay their eggs around the anus, which can lead to intense itching. These symptoms are quite typical. I'd like to take a quick look and confirm.
Je suis un peu inquiète, docteur. Est-ce que c'est quelque chose de sérieux?
No need to worry too much. Pinworm infections are very common in young children. They're uncomfortable, but they're not dangerous. The most important thing is to treat them properly to avoid reinfection.
D'accord, ça me rassure un peu. Mais comment il a attrapé ça?
Pinworms are easily spread through contact with contaminated surfaces. For example, if he touches something with pinworm eggs, like a toy, a doorknob, or even bedding, and then touches his mouth, he can get infected. They can also be transmitted if he scratches the area and then touches something else.
Ah, je vois. Donc, il faut bien nettoyer la maison, ses jouets et tout ce qu'il touche?
Exactly. Frequent hand washing is essential, and you'll need to wash his bedding, toys, and clothes regularly. Since pinworm eggs can survive on surfaces for up to 2 weeks, it's important to keep everything as clean as possible. Make sure he doesn't put his hands near his mouth after scratching and try to keep his nails short to reduce the risk of egg spreading.
D'accord, je vais m'assurer qu'il se lave bien les mains, mais quel est le traitement pour ça?
The treatment typically involves a medication that you can get from the pharmacy. It's usually a single dose, but it's often recommended to repeat the dose in 2 weeks to ensure all the worms are gone. I'll also give you a prescription.
Et est-ce que c'est dangereux pour ses frères et sœurs?
It's very easy for the whole family to get infected, especially if you're living in close quarters. I recommend treating all household members at the same time to prevent reinfection. It's also a good idea to disinfect common areas like bathrooms and the kitchen.
Nous avons une routine assez chargée, docteur. Comment savoir si nous avons été infectés aussi?
The symptoms for adults are usually mild and might include itching around the anus, especially at night. If you notice any of these signs in yourselves, you can take the medication as well.
C'est un soulagement d'entendre que ce n'est pas dangereux, mais est-ce que nous devons changer son alimentation ou faire attention à autre chose pendant le traitement?
There's no need to change his diet. Just make sure he gets plenty of fluids, as diarrhea can cause dehydration, and continue with the normal care you're already providing, including the hygiene practices.
Et quand devrions-nous revenir pour un suivi?
I'd like to see you again in about 2 weeks after the second dose of medication to make sure everything is cleared up. If you notice any worsening of symptoms or if he has trouble with the medication, don't hesitate to come back sooner.
Merci beaucoup, docteur. Nous allons suivre vos conseils.
Oui, merci. Nous allons aussi désinfecter tout ce qu'il touche et lui rappeler de bien se laver les mains.
Great. I'm confident that with proper treatment and care, David will be feeling better soon. Don't hesitate to reach out if you have any questions in the meantime.
Merci encore, docteur. À bientôt.
You're welcome. Take care, and I'll see you soon.